My name is Dr. Pradeep C. Bollu, and I'm a neurologist at Prisma Health. Neurology is the science of brain, and it involves understanding the complicated circuitry inside the brain and all the diseases that affect it. And neurology encompasses a multitude of specialties, including headache medicine, movement disorders, multiple sclerosis, etc. Since I was a kid, I was always interested in complex circuitry, and my proclivity towards biological sciences brought me closer and closer to the brain. As I got into med school, brain was so fascinating that I decided to become a part of neurosciences. I believe in patient education a lot. It is important for good patient outcomes. When patients and family know what their disease process is and what their different treatment options are, they'll be more involved in the patient care, and that results in best patient outcomes. I always put time and effort to educate patients about their condition and what the different treatment options are. To be honest, this is the best time to be a neurologist because the field is expanding and exploding with different treatment options. Let's take, for example, multiple sclerosis. The number of medications that came out in the last 5 to 10 years are way more than what we had in the last 30, 40 years. Similarly, in the field of movement disorders, neuromodulation has become a very common modality of treatment and in some cases standard of care. Similarly, in many areas of neurology, neuromodulation and new therapies are coming out, making it more fascinating and interesting to treat patients and make their lives better. My passion in treating my patients comes from the fact that I can make their lives better. I can be their friend holding their hand as the disease process advances. In some cases, I may not be able to change the outcome, but at least that gives me a lot of satisfaction to be part of the treatment team, part of the family, part of the decision-making process in making their lives better. In some cases, the treatment options and the interventions would improve the disease condition significantly. So the patient walking out with a smiling face is something that makes me happy and ignites the passion inside me. The most important thing in terms of patient's health is understanding the disease process and understanding how it all started. In many cases, the disease process has roots in bad lifestyle choices, in bad emotional states. So making the patients aware of those things is the first step in making them get to a better place. I talk a lot about what patients need to do in terms of their day-to-day activity, in terms of their exercise, in terms of their dietary habits, in terms of their emotional state. And all those things combined can get them to a better place. Outside of work, I enjoy playing badminton, I enjoy playing cricket. I also collect a lot of music gear, including vintage speakers and audio amplifiers. To make an appointment with me, please talk to your primary care provider and ask for a referral.